Well, I get so many questions regarding some common things, and one of them, of course, is salt. And if you're biblical, you'll understand this. There's a place where in the Bible where God says, "Go forth and be a salt of the earth." A little bit of salt can do a lot for flavoring a big stew pot, right? And so what he was asking is for us to, even though we think we're small and insignificant, don't have much in the way of power, one person can have a huge positive effect, okay, by bringing good information around. Well, God lives forever. Doctors say don't use salt, and their average lifespan is 56. So I'm going with God on the salt thing. Then, what are the functions of salt? Well, many things. People don't realize just how ubiquitously used salt is. First of all, the normal pH, or the acidity, alkalinity of your stomach, has to be below 2. 1 being the most acid, 14 being the most alkaline, 7 being neutral. And to make things work, you have to have your pH down below 2. 1.2, 1.5 is where you want your stomach pH. And the stomach pH is required for several things. Number one, it's required to make your stomach sterile, because salt, sodium chloride, is the raw material for the chief cells in your stomach to make hydrochloric acid. And the hydrochloric acid, of course, keeps the stomach sterile. And when you have a pH below 2, 1.2 to 1.5, nothing will grow in there. You get up around 4 or 5, kind of like vinegar, and you're pushing towards neutral, which is 7. You're going to have yeast and bacteria grow in there. You generate gas every time you eat, because these bugs love that environment. It's wet, it's moist, it's dark, it's warm. You give them food 3, 4, 5, 6 times a day, and they will generate gas. You get heartburn, you get reflux. And of course, reflux is not acid reflux, it's lack of acid reflux. We actually have a wonderful product called Ultimate Enzymes. It has a stomach acid in it to help you get that stomach acid down below a pH of 2. And all how this works, of course, is in the book Epigenetics. And so lack of acid reflux goes away when you get the pH of your stomach down. Just the opposite of what doctors do with their proton pump inhibitors to prevent the production of salt. And then you cannot digest protein into amino acids, because the pepsin, the enzyme produced by the stomach to digest protein down to amino acids, requires a acid environment below 2. You cannot absorb B12, vitamin B12. Even if you're eating 5 pounds of it a day, you'll still have to go to the doctor once a month to get a B12 injection if you don't have enough stomach acid, because the intrinsic factor that's required to join with the B12 to get absorbed requires a pH in your stomach below 2, 1.2 to 1.5. And then, of course, again, the chlorine part of the sodium chloride is the raw material your stomach, the chief cells, use to make HCl, hydrochloric acid. And then the sodium part, people say, well, that's the bad part. You got to keep your sodium down. No, sodium is useful because it's actually required. It's a required nutrient. So is chloride. Sodium's a required nutrient because it's used as a cofactor, as a catalyst for many, many subcellular chemical reactions, also for things going on in your nucleus of your cells. Even DNA and chromosomes all require sodium as cofactors to work. And so any doctor who would tell you to restrict salt really should be held in contempt. You should fire them, tell them you're Donald Trump, and they're the what do you call it, the apprentice, and they're fired. And so we have to really rethink everything that the doctors have taught us. Remember, the halls of science are filled with thousands of failed medical theories. And this is the purpose of the book Epigenetics, The Death of the Genetic Theory of Disease Transmission. Everything that happens to us because we don't give our genes, our DNA, and RNA all the nutrients they need. 60 minerals, 16 vitamins, 12 essential amino acids, 3 essential fatty acids. And the minerals include sodium and chloride. You know, these are elements, a.k.a. minerals. And so it's imperative that we do the right thing. When you go against the things that we require to follow a doctor's pontifications, doing these things, between getting people off of saturated fat and putting them on oils, getting them off of salt, doctors have killed billions of people. They make the Nazis pale, okay? Every year around the world, medical doctors, primarily from America, have killed billions of people with their incorrect advice. And so the book Epigenetics is designed to help the general public save themselves from these really, really bad instructions. There's a wonderful study that just came out a couple of weeks ago It showed clearly that medical doctors know little or nothing about nutrition. They don't know anything about exercise, yet they pontificate on exercise and they pontificate on diet. They shouldn't say anything. They should keep their mouths zipped on those things. Again, around the world, giving this advice around the world, American doctors alone have killed billions of people, and it's just, it's not tragic, it's criminal. What other institution in America alone kill, injure, and infect 15 million Americans every year in their workplace, not even get an OSHA ticket? This is a front-page story on the USA Today, February 5th, 2007. That's not me. I'm just reporting what was reported. Each month in America, medical doctors kill 15,000 seniors, 180,000 a year, when they put them in hospitals for screening tests and minor procedures. Medical doctors kill 15,000 seniors a month in hospitals and clinics doing minor medical procedures and screening tests. Get the book, Epigenetics, The Death of the Genetic Theory of Disease Transmission, and save yourselves. It'll be the best investment you've given out for a long time to save your life. Better yet, also the life of your kids. Well, stick with us. We'll be back with Dead Doctors Don't Lie for these messages. Okay, Doug, what pearls of wisdom do you have for us today?
Well, I think we should start out with this. Now, I gave you two because this topic is one that you have been talking about as long as I've known you, which is going on about 18 years now. And this is a story that was a UPI story. It was also in the Wall Street Journal. And it is a headline reading, "Current Salt Intake Recommendations Too Strict," researchers say. They say federal health officials recommend about 1,500 to 2,300 milligrams of salt per day. The American Heart Association, a little more strict. They say no more than 1,500 milligrams, and anything over that is too much. And there's new research that suggests eaters should shoot for between 3,000 and 6,000 milligrams of salt every day. This was published in the New England Journal of Medicine. Yeah, they say the U.S. daily consumption of about 3,400 milligrams is not only perfectly fine, but may be healthier than abstaining. There was an international survey that looked at the health outcomes and salt intake information for about 100,000 people in 18 different countries. Researchers found that increased salt intake drives up blood pressure in older adults already dealing with high blood pressure. Results suggest that those who consumed between 3,000 and 6,000 milligrams of salt per day had fewer cardiovascular problems than those who ate less than 3,000 milligrams or more than 6,000 milligrams. They also found that those regularly eating potassium mitigated the blood pressure increases brought on by high salt intake. And they say, in other words, healthy adults who get plenty of potassium don't need to worry about their salt intake. And there was a Dr. Suzanne Apparel. She's a cardiologist at the University of Alabama where this study was done. And she wrote an editorial that accompanied this survey. She said that she and her colleagues aren't advising eaters to pile on salt, only that they should take a more bird's eye view of things. And they go on, of course, they get a quote from the president of the American Heart Association. Of course, we know them as the pushers of Crisco in order to further their little plan. And they say Dr. Elliot Antman, that is the president. He says he's pledged his support for lowering salt intake and questions the methods of the study that undermined his organization's recommendations. He's quoted as saying, "We hold fast to the recommendation that there is a need to reduce sodium intake in the diet." And the other doctor that did the study, Dr. Apparel, she says her colleagues admit that their study does have some certain limitations, but she does point out that Japan is one of the highest salt consumers in the planet, and they have one of the longest lived lifespans of all the people. So who's right there, Doc?
Well, observational stuff is the most important thing, and so the fact that the Japanese actually take in 10,000 milligrams of salt a day each on the average. Some are up to 25,000 milligrams, and as you point out, they're amongst the top 20 longevity cultures, particularly the Okinawans, which is a big island off of Japan. And salt, again, as I said in the monologue, is made up of two essential nutrients, sodium and chloride. And it's like saying, now you can't have too much calcium because you're going to get kidney stones. Well, kidney stones are caused by raging osteoporosis. That's another mineral fable that doctors keep pushing, kind of thing. Also, they say, just eat broccoli, you get all the calcium you need. Just eat fish, you're going to get all the sodium you need. That's nonsense. And so you have to supplement. When wars have been fought over salt. I mean, even people back in the days of Hippocrates knew thousands of years ago that there are a lot of men that don't seek gold, but there's not a man that can live without salt. They were pretty smart back in the old days, and so I'm going with these guys. But thank you so much, Doug, for the flourishes and for doing all that. Yeah, we've been talking about this one for 36 years, and really appreciate it. Thank you. We'll be back after these messages. Okay, Doug, let's go to callers.
Let's head to Pennsylvania. And Don, you're on with Dr. Wallach.
Don, you're on the air.
Thanks. Calling about my 8-year-old son. MDs have him diagnosed with it. That's called atypical hemolytic uremic syndrome and anti-factor H antibodies. When he gets the sickness, fever, stomach bug, we check his platelet levels and we check his LDH levels to see, if the platelets are going down, the LDH is going up. The treatment is fresh frozen plasma and lots of steroids. Okay, well, let me ask you a couple of questions. You have any other children? Yes, one thing I was going to mention, I do have 2 girls. We had another son, our firstborn passed away from complications of this type of issue 10 years ago.
Okay. Now, do any of the girls or your wife and anybody else have respiratory problems, any eczema, dermatitis, belly problems?
We've had belly problems. I got 2 kids, every now and then tummy hurt. They all have the 3 kids that I have in the home now.
I'm sorry, you say they all have asthma?
Yeah.
Okay. All right. How much does this boy weigh?
He's 100 pounds.
Okay. Now, Shar, are you on the line?
I'm here.
Okay. What's the problem in this family here?
They're all gluten intolerant.
Absolutely. This is drop-dead gluten problem. And
yep.
It's kind of like when somebody has an iron deficiency, Don, and you go to a doctor and he says, we're going to do a bone marrow transplant here. Well, that's really not going to solve the problem, but that's what they do because in their mind, what you've got is a genetic problem here. It's in your wife and your 2 daughters and son. Do you have another son or just the 2 daughters and son?
2 daughters and son. Our first son passed away 10 years ago.
Yeah, okay, so you had 4 children altogether. And what was the cause of death? You said from the same sort of things. Did he have belly problems or?
No, he was sick in the hospital. We're checking the platelet levels, and it was influenza, and it swelled the brain stem, I believe. So it was, we got to do brain,
Yeah.
Third, and it was, it was.
Okay, well, hang on. We'll be back here with you, and we'll give you some advice on what to do here. We know what the problem is. Doctors have missed it by 1,000 degrees and 180 degrees. They've missed it badly. We'll be back after these messages. He says, okay, Doug, let's go back to Pennsylvania and Don. Okay. Anybody in your household had their appendix out?
No.
Okay, good. So, at any rate, Shar was 100% correct. You have a gluten problem. Your wife's siblings, her brothers and sisters, her mom, her mother's siblings, and all the children of her mother's sisters, if there's any sisters involved, because women pass it on. Doctors would say this is a sex-linked thing, but it's not sex-linked. It actually is. Women pass gluten intolerance on. It's not a wheat allergy, but it's a contact enteritis, just like poison ivy is not an allergy to poison ivy, but it's a contact dermatitis. But women pass it on through cord blood and breast milk, and since men don't breastfeed or carry pregnancies, they don't pass it on, but they do get gluten intolerance. And it causes a huge malabsorption problem where you lose the efficiency of absorption because you're losing the villi. And so your intestines might lose as much as 85 to 90% of the absorptive surface, and the intestines become as smooth as a garden hose on the inside when you lose all this stuff. And people begin to, even if there's some things in your diet, you're not going to absorb them very efficiently. And if you have very little, let's say you have 5% of what you need of iron to prevent all this anemia and not enough vitamin E in his diet because he can't absorb it because of this lack of absorption, it's going to cause all these problems. And this is why it looks familial. This is why it looks genetic, but it's not. And so I urge you to get everybody gluten-free. I mean, drop dead. Everybody's got to sit down and a family pledge that for the safety of everybody, they got to be gluten-free because of cross-contamination in the laundry, food preparation surfaces, the couch and rugs where everybody watches TV, the bed where people sleep together, in bedroom. It's imperative. Cat food. I had a case the other day. A 19-year-old boy was deathly sick, and the doctors just couldn't figure it out. He had a gluten intolerance. There's no doubt about it, but everybody swore, in the Bible that they were gluten-free, and I visited their house just before I left town. It was in Lewiston, Idaho, and the cat runs in front of me. He says, well, who's feeding the cat? He said, well, Alex, the boy that had the really severe symptoms of gluten intolerance. So let me see the cat food. Sure enough, the second ingredient was wheat, dry cat food. And he was the one feeding, and he was getting the dust by feeding the cat this dry dog food, or cat food that had the second ingredient was wheat. That's how obsessive the family is going to have to be about gluten. Then, at 100 pounds, what would you do for this boy, Shar? He's got stomach problems, and what would you do to kind of help settle his stomach, help him with digestion and absorption? What would you do for him?
Well, I would get him the root beer belly, and I would give him the enzymes too. And he needs to take a healthy start pack. Really, one is plenty.
Yeah, one is plenty for 100 pounds. Healthy start pack. Divide it in half a dose for everything at breakfast and dinner. Char's right. One of the ultimate enzymes. 2 minutes before each meal, a couple ounces of water. And the root beer belly is probiotics. Help calm things down. Stay away from the bad stuff. No fried food, no margarines, no oils, no gluten. And call us every time you get more information. We'll be back after these messages. Callers.
Let's head to Michigan. And Lindsay, you're on with Dr. Wallach.
Hello, Lindsay. You're on the air.
Hello, Dr. Wallach. I met you yesterday. I just wanted to say thank you so much, and I'm taking your advice and telling everybody my testimony.
Would you share your testimony with us? I remember, but I want you to share it with our listeners.
Okay. Well, I used to have 300 seizures a day. I was medicated my whole life since I was 10 years old.
Okay, so from the time to 10 till what age did you have these seizures?
23.
Okay, so for 13 years you've had these seizures. 300 a day sometimes.
Yes.
Okay.
And I just stopped taking my last prescription pill last Tuesday. I no longer have seizures. I'm no longer bipolar. I lost 75 pounds. No more depression. I used to be very, very suicidal. I can't remember the last time I felt that way. I've never been happier in my whole life since I started taking your product.
What longevity programs did you take?
I take a healthy start pack and a gluten-free diet, and I also take Smart FX and Renew IQ.
Very, 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 very smart young lady. And so you're 23 now?
Yes.
Okay, and that your baby crying in the background?
Yes.
How old's the baby?
19 months.
Wow. Well, thank you so very much for sharing that. And do you have brothers and sisters or mom and dad that have problems too?
Yes.
And have they been helped with the longevity program?
Yes.
Okay, you're going to have your mom and dad call up and have them give their testimonies too. Would you do that?
All right. I also have a question.
Please. Mm-hmm.
My dad's friend Bullseye in Texas, I don't know if you remember him, his daughter couldn't get pregnant. Well, guess what? She is, and she wants to know what to do.
Well, she's going to have to wait 9 months for the results if she just got pregnant, right?
Yes.
Has she been taking vitamins and minerals?
Taking the products.
Okay, and she was taking the products, and that's what helped get her pregnant, right?
Uh-huh.
Yeah, I get about 25,000 women pregnant every year by doing this, and it's, again, if this is your sister?
No, my dad's friend's daughter.
Oh, your dad's friend's, so she's not directly related to you. Okay. So, at any rate, yeah, it's not unusual that women who have a gluten intolerance will have miscarriages, and doctors will falsely portray them as being infertile. They say, oh, you're infertile, you need to pay us $25,000 for fertility, where you get in vitro fertilization or what do you call it, where you do fertilization. They actually do it themselves as opposed to having a man have sex with a woman. Okay, and what happens here is women don't have enough nutrition because they have a gluten intolerance. They can't absorb these things. Okay, and once you get people off of gluten, get them on a gluten-free diet, get them on the 90 essential nutrients, they're able to absorb enough nutrition that they're able to maintain a pregnancy. And so the fact that she's now pregnant, it's a great thing, and she needs to stay on a gluten-free diet. And do you know how much this young lady weighs? Lindsay?
Yes.
Do you know how much she weighs?
No.
Okay. Well, per 100 pounds of body weight, I'd have her take, like Char would say, one healthy start pack per 100 pounds of body weight, unless she has some other issue. But being gluten-free, the entire family, the husband, the dog, the cat, the bird, the fish, mother-in-law, everybody living in the household's got to be gluten-free, and this will be a successful venture. And I always ask, if it turns out to be a boy, name it after me, Joel, and if it turns out to be a girl, name it after me, Jolene. So there's lots of Jolenes and Joels running around. Okay? Thank you very much. A really great testimony, Lindsay. All right, Doug, let's go to callers.
Let's head to Pennsylvania, and Jackie, you're on with Dr. Wallach.
Hi, Dr.
Oh, Jackie, you're on the air. Hi, how can I help you?
I have two questions. One is about acoustic neuroma. I'm calling about a male who had this 10 years ago, had surgery, and then it went away. I mean, they took it out, and then it's recurred the last 2 years. This person had gamma radiation, and it's affecting his facial nerve this time.
Okay, now stop a minute. How did this manifest itself? Did he have ataxia, or he's walking around like he has motion sickness? Did he have nausea? Did he have ringing in his ears?
I believe that he had. He lost his hearing.
Okay, so did he suddenly? Did he lose his hearing suddenly, or over time?
I'm not sure. I think it was a short amount of time that he lost the hearing, and that's what alerted him that it was something serious.
Okay. Do you know much about this young fella?
In regard to his diet and all of that?
Yeah.
Yeah, I know that he's, from what I've heard on your show where you talk about the gluten intolerance, he does have eczema and he does have a lot of acid reflux. So I'm...
Yeah, he's got a gluten intolerance. Yeah, if he has eczema, he's got a gluten intolerance. And Shar, how much does this guy weigh, Jackie? Hello?
200 pounds.
200 pounds, okay. And so, Shar, what would you do for a 200-pound guy that had deafness and things going on in his middle ear?
I give him 2 healthy blood sugar.
Brain.
2 healthy brain and heart packs. I'm okay. And for the ringing in the ear and everything, he needs Ultimate Daily, and then he can put some CM cream in his ear to see if he can get some of the hearing back.
Yeah, and he might be able to get some of that hearing back unless they've totally damaged him with the surgery. So that's a possibility there. And anytime people have tinnitus, ringing in the ears, they have ataxia. It used to be called Meniere's disease, where people feel like they have motion sickness. They get a little nausea and they're kind of wobbling around like they're drunk. And sometimes you have both. They can get gradual deafness. So those 3 things kind of go together when you have a squeezing of the roots of the 8th cranial nerve. And the fact that they treated him, did surgery, did radiation, and he's begun to have effects on the facial nerve, the 7th cranial nerve, which comes out from behind the ear from the same place the 8th cranial nerve comes from. And they're damaging that, and so he has, something like Bell's palsy. Okay? And this is things that we have to look at. And Shar says, I'd get him 2 healthy brain and heart packs, 3 of the selenium twice a day, 1 ounce of the OsteoFX Plus twice a day, 2 scoops of the Antan-Tangerine 2.0 NutriCrystals twice a day, 3 of the EFA Pluses twice a day, 3 of the EFAs twice a day. All that will be accomplished by the 2 healthy brain and heart packs per month. As she said, I'd get him the Ultimate Daily Tablets, 1 bottle a month. That'll be 3 of the Ultimate Daily Tablets at breakfast and dinner, And this is to deal with circulation, support healthy circulation in that ear and all over his body, for that matter. And put the CM cream. He'll have to buy 2 bottles of CM cream per month. Put a half a teaspoon of the CM cream down in each ear with a Q-tip like he's trying to get wax out, and see if we can't get some of that inflammation out of there. And this is all caused by osteoporosis of the skull, and they do all this surgery and radiation. It just makes you want to throw up. Thank you, Jackie. Call me every 2 weeks. We'll be back after these messages. We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Longevity, 90 for Life Crusade. And Doug, let's go to callers.
Let's head to Atlanta, Georgia. And Anthony, you're on with Dr. Wallach.
Now, Anthony, you're on the air.
Hey, Doc. I got a young lady, 43, 267 pounds, 5'7", got type 2 diabetes, severe anemic, asthma, sickle cell trait, fibroids, arthritis in the left knee, seasonal allergies, and she plans on signing up for the business tomorrow.
Okay, good. Now, you said 267 pound weight?
Yes, sir.
Okay, now let's go down this again. In addition to her weight problem, because she needs to lose 100 pounds at least, okay? And then she has type 2 diabetes. I got asthma, sickle cell trait, and what else? I missed it.
Fibroids, arthritis in the left knee, seasonal allergies, severe anemic, and asthma. And she's on the line.
Okay, good. Okay, Shar, this is a Shar thing. We only have a few moments, so what would you do for this gal? She's a big girl, and we have to go by body weight, and, you want to go with the most life-threatening thing first, and so what would you do for her type 2 diabetes?
Well, the healthy blood sugar pack, but she needs 3 of them, unfortunately.
Yeah, ideally she would need 3. If finances are a problem, I wouldn't go less than 2 because with taking 1, she's not going to see much, right?
Yeah, correct.
Okay. And what would you add to the, and again, Anthony, we're going to give her the ideal, but if she has to cut back because of finances, we understand that because this is going to be a big project here. Okay.
Well,
so
for the sickle cell anemia, she needs the selenium.
Yes, and so I'd have her take 3 selenium 3 times a day. That'll be 3 bottles of selenium per month, or Ultimate Selenium. Okay, and that will help. And we get this with many, many people every month where they don't have crises and don't have blood clots and stuff because it actually, my book that's in the Smithsonian Institute has the first cases of sickle cell anemia in animals. And we learned how to manage them in animals, and this is because it's a inborn error metabolism. It's not genetically transmitted. It's actually caused by mama being deficient in nutrients while the hemoglobin forming equipment was being formed in the bone marrow when this lady was a embryo. Okay, so we can manage it. Can't totally cure it, but we can manage it much better than doctors do by giving her treatment after she has a crisis. Okay, what about the asthma and the let's see here, the asthma and also the skin problem. What skin problem did she have? Did she have eczema?
No, I don't have eczema.
Okay, any dry skin?
No.
Okay, but you do have asthma?
Yes.
Okay.
So,
okay.
Yeah.
I've had asthma since I was a child.
Okay, so yeah. Okay, so, do you have children, ma'am?
Yes.
Okay, yeah. You pass this on to them, so they may show up as appendicitis or belly problems or skin problems, all kinds of stuff, but you got to get them gluten-free too. Shar said you're gluten intolerant, so you need to be gluten-free. You're going to get maximum results here, and it's going to save you a lot of money to get gluten-free. It's going to contribute to helping you lose the weight. So I'm going to go fast here. So I want you to have 3, ideally 3 healthy blood sugar packs per month, full dose of everything at breakfast, lunch, and dinner. For the sickle cell, as Shar said, perfectly, an A+ for her. This is 9 of our Ultimate Selenium a day, 3 at breakfast, 3 at lunch, 3 at dinner. For the arthritis, I would also have her take 2 bottles of glucogel per day, so she can have 15 glucogel per day, or 2 bottles per month, so you can take 15 glucogel per day, 5 at breakfast, 5 at lunch, 5 at dinner, and that's designed to support and promote maintenance repair of the cartilage, ligaments, tendons, connective tissue, bones itself. Be sure to take your fasting blood sugar, ma'am, every day. As it drops below 100 without medication, you should be weaned off your medication. And for the weight, I also take the ASAP under your tongue, 1 bottle a month. That's a dropper full under your tongue, 30 minutes before each meal. And call me tomorrow again. We'll go over some more. But let's get started. Okay. Well, thank you so much, Anthony. You and this young lady can call again tomorrow so we get more details. Thank you, Shar. Super job. Thank you absolutely so much, Doug and Richard. Superlative job as usual. God bless each and every one of you. God bless our troops. God bless our Navy SEALs. And God bless America.